Dr. Tom Frieden, former director of the CDC, and of course now CEO of Resolve to Save Lives. I wanted to ask you about this new WHO report on hypertension, which had some alarming global statistics in it. First, give us the headline, and I want to talk about why we think this is happening globally.
The bottom line here is that the world's deadliest condition is also the most neglected, but we can change that. More than 10 million people die every year because of elevated blood pressure. That is more than all infectious diseases combined, and it's rich and poor, urban and rural, and in lower income countries, the numbers are increasing steadily. The good news in this report is that treatment programs and prevention programs work. And by improving the control of blood pressure, we could save, over the next 25 years, 76 million lives, prevent 120 million strokes, and 80 million heart attacks. And there's one number, and only one number, that people should know, and that is what proportion of all people with high blood pressure have it under control. Globally, it's approximately 1 out of 5. There are only 3 countries in the world that reach even half. Costa Rica, South Korea, and Canada. Every other country can improve a lot, and even those countries can improve more. And if we do that, it's going to save lots of lives.
I'm struck by the fact that early in the pandemic, in 2020, there were many reports about people putting off well care, not seeing their doctors, failing to follow up on vaccinations. Has that trend continued through the past few years, and what is the overall state of well care globally?
There's a huge harvest of illness and death from the pandemic and from the disruption. Cancers that weren't diagnosed, blood pressure that wasn't treated and people have heart attacks and strokes, tuberculosis that wasn't diagnosed and treated, setting back tuberculosis control by many years. What we must do is get the 3 R's right. A renaissance in public health, robust primary healthcare at the center of our systems, of our healthcare systems, and resilient populations able to withstand the inevitable threats that are coming our way. And primary healthcare is the most neglected part of our healthcare system. There are very few countries that get this right, but fundamentally, every person should have a source of care, whether it's a clinician or a team or a facility that they can trust and that's accountable to them and that they're accountable to for getting their health care so that they can stay healthy. And if that comes out of the pandemic with advances in telemedicine, which were one of the very few positive implications of the pandemic, we'll be a much healthier and a much safer world.
You know, I'm struck by the fact that as we have this conversation about the need for deeper investment in health systems globally, we're also in the midst of the deepest sovereign debt the world has seen, and poor nations are getting poorer. So what is the solution? Where does the money come from, and how do we ensure that there is a focus on making sure developing nations get the health care they need?
We need to spend more and spend better. We need to make sure that there's a realistic sharing. You know, it just costs a penny to get the medicine for high blood pressure, high cholesterol, high blood sugar. The main 3 medicines, atorvastatin for cholesterol, metformin for sugar, and amlodipine for blood pressure, cost a penny a pill. Wouldn't cost that much, a tiny fraction of pharmaceutical profits, just saying, to have some real equity, but at the same time, working with countries around the world to set up systems that are going to make the maximal difference, sustainable, substantial progress.
Finally, the big 3 C's that have been talked about at most global convenings in the past 3 years are COVID, conflict, and climate. I would say the COVID conversation has fallen by the wayside, but we're in the middle of a new variant wave. Where are we at in the fight against COVID globally?
COVID has become one more dangerous thing on the landscape of dangerous things. It could get a lot worse, it could get better. Year to year, it's going to change, and that emphasizes the need to be situational, to know what's happening, to track what's happening all over the world, and then to respond quickly. That's why we're advancing, and countries and organizations are adopting the 717 target, that every single outbreak, whether it's a new strain, a new virus, another threat, is identified within 7 days, reported to public health in 1 day, and all essential public health control measures in place within 7 days. If we do those 3 things right, we'll drive down dramatically our risk of future death and economic dislocation.
Dr. Tom Frieden, thank you so much.
Thank you. Great to speak with you.